Hi, I'm Danielle, the physiotherapist with Strength and Youth Therapy. We're here today with Brad, who's a patient who's been experiencing some knee and ankle pain on his left side, especially when he's been running, squatting, jumping, doing any weight-bearing activity. Today what we're going to do is assess some common causes of this knee and ankle pain. It's often due to a muscle imbalance within the whole lower kinetic chain, so from the hip, knee, and ankle. In these muscle imbalances, the forces acting on the joints are pulling the joints out of alignment, which causes pain within the joint. One of the muscles that is commonly misused or underused is your gluteus medius muscle. So today what we're going to be doing is assessing the strength and activation of Brad's glute med. We're also going to be palpating for adhesions, doing some soft tissue work to lengthen and release the adhesions in the glute med, and then teach him some strengthening exercises to wake up the glute med fibers and activate it. So I have Brad here in side lying. Usually with knee and ankle pain, we assess the whole lower kinetic chain, so starting with the hips and then working downward. What I'm going to do in side lying is first palpate his glute med muscle. So you can do that by finding the back of your hip, so it feels like a ridge along the back here, and then from here, if you point your fingers towards the hip bone or the greater trochanter, the glute med kind of acts as a fan shape or a slice of pizza working along these. So what I'm going to do is feel along the crest, come down onto his glute med, and feel around for any muscle adhesions or any trigger points. Okay, so keeping that palpation on, what I'm going to get Brad to do is a side lying leg raise. So Brad, can you lift your leg up into the air for me? Good, and back down. Good. So what we're seeing are a bit of compensations that are common with the glute med weakness and instability. What we're seeing is his leg come forward. So that's using the tensor fasciae lata muscle more anteriorly located in the front. And glute med's not turning on. And then he's also rotating his foot outward, again, compensating with other muscles. So now that I'm going to correct him, can you bring your leg straight back so your hips are straight and your foot's going to be internally rotated? Okay, now I want to see you bring it up. Now I'm feeling glute med fire. Okay. But again, it's a little bit shaky and unstable, and that suggests to me that there is a weakness with endurance and also a slow firing and activation. So the first thing we're going to do to treat Brad's glute med weakness is relieve some of the adhesions I've found in his glute med muscle through a passive release technique. So while I'm pressing on an adhesion here, I'm going to bring Brad's leg into extension and external rotation, and then through range. So I'm locking off on the adhesion and bringing it through range. Okay, so normally we do enough passes to make sure that we've released all of the adhesions in the glute med. This allows the muscle fibers to lengthen and more easily activate. Now that we've done some of the passive release, we'll reassess his side lying straight leg raise. Already those fibers are firing quicker and more smoothly. So what I'm going to do now is give Brad a few exercises to activate glute med and strengthen it. So Brad, when you're doing this exercise at home, I want you to palpate your own glute med muscle. So you can do that first by finding the posterior wall of your hip bone or pelvic bone called your iliac crest. And then from there, put your palm in and pointing down towards your greater trochanter. Good. So that's about the origin and insertion of your glute med muscle. So now with your hand here, feel just below the crest of your hip bone. Good. You should be on your glute med right now. Okay. Now we're going to bend up this bottom leg just for extra support. Straighten out this top leg. This is best to do against a wall at home just to ensure you don't cheat and bring your leg forward and compensate with other muscles. So if the wall was here, you'd have your heel hips, and shoulders touching the wall, and keeping them touching the wall and your toes pointing in. I want you to bring your leg up to about here and then slowly lower with a count of 5. The slow lower or eccentric control helps with endurance and strength for your glute med muscle more than going quickly up and down. Okay, so we would do 10 of those with a rest and 3 sets on each side. Okay, so today Brad came in with some knee and ankle pain. We then realized that the issue was actually not where the pain was situated, but higher up the kinetic chain, all the way from his hip. So if left untreated, the joint malalignment caused by this instability can lead to osteoarthritis, muscle imbalances that can lead to strains, sprains, and even tears. So it's important to treat the problem, not just where the pain arises, but throughout the whole kinetic chain. I'm Danielle Ufniak, the physiotherapist at Strength and Youth Therapy. If you're experiencing pain like Brad's or any other aches and pains, come see me for an assessment and treatment, and we can get you back on track.